Hello everyone and welcome to Health Talk, a service of Pikeville Medical Center. I'm your host, Jill Fraley-Dotson, a time we get together to discuss prevalent issues going on in our community and around the world and the hospital's impact that it's having on everything that goes on in the world health-wise. Today our guest, Dr. Fadi Alacross, no stranger to Health Talk, certainly have been with us before. Thank you for being here again today.
Thank you for having me.
Dr. Fadi is the Director of Infection Control and Disease at Pikeville Medical Center. So we are talking about a subject today that we hear a lot about in the news, read a lot about in the papers, but sometimes it's kind of hard to understand what the Zika virus is, and a lot of people get very worked up and fearful when they hear about things that we don't know a lot about. So we're hoping to clarify some of those issues today. First of all, tell us a little bit about your position at the hospital.
Okay, my name is Fadi Alacross. I'm the infectious disease specialist at Pikeville Medical Hospital. And definitely Zika virus, one of the infectious problems circulating now in the community and around the world, and posing tremendous pressure and anxiety across the United States and across the whole world. What we know at this point, just a little bit about Zika virus, just the tip of iceberg.
Yeah.
Okay, and hopefully we could be able to collect the pieces of the puzzle in the next few months and next year, and we'll be able to figure out exactly how Zika is transmitted and the complication that could be associated with Zika virus infection.
So let's get right to it. First of all, explain what Zika virus is.
Okay, its name came from Zika forest in Uganda. It was initially isolated back in 1947, and subsequently the infection had spread to Asia and Africa. Recently, we've seen what's called Asian epidemics in Micronesia, in French Polynesia, and then in 2015 we started seeing these cases in South America, mainly in Brazil. And from Brazil, the infection started to spread in the Western countries. We don't know if the virus has mutated because we didn't have these problems in the past, especially with microcephaly and other neurological complications. But the other issue could be these tragic side effects may have gone unnoticed for many years, and nobody paid attention to these complications that could be linked to Zika virus.
How does Zika affect people?
Primarily, this infection is transmitted by Aedes, which is these kind of mosquitoes are very aggressive mosquitoes. They're not daytime biters, and they can feed both inside and outside. And the problem with these Aedes, it can transmit the infection from human to another human, which means if the human is infected with the virus, the mosquito could be infected and subsequently transmit the infection to other people. It's very important to understand the structure of these viruses because Zika virus is part of the Flaviviridae, and we have multiple viruses that belong to these this family, including the West Nile, the dengue, and chikungunya. It's very hard to determine which one is causing the problem, and subsequently we have to do more testing and more analysis to figure out which agent is the culprit agent. But I think these viruses, they behave almost similarly, and they are transmitted by mosquitoes, mainly the Aedes mosquitoes.
So when it comes to affecting people, what can they expect?
So majority of patients infected with Zika virus are asymptomatic, which means they have no symptoms. We're talking only 1 out of 5 people infected with Zika virus, they have symptoms. And usually the disease is not severe and does not require hospitalization. Risk of death is very minimal. However, this is a list of symptoms that could be accompanied with Zika virus infection. As I mentioned, they're very mild, including fever, including rash, joint pain, red eyes, muscle pain, headache. These symptoms are not pathognomonic of the Zika. So you can see them with other viral illnesses, and it's very hard to tell if these symptoms are coming from Zika or not. Subsequently, you need to do very good history regarding travel, and you have to make sure that these people have been bitten by mosquitoes to be able to determine if these people bitten by Zika virus mosquitoes.
What are the risks to have other infections?
As I mentioned, mosquitoes can carry other viruses, and the most common ones are the dengue virus and chikungunya. You cannot tell, as I mentioned before, from symptoms which one is the causative agent. That's why we need to test for these viruses to be able to determine which one is causing the infection. On the top of that, serologies for these viruses can cross-react. Sometimes we have positive Zika virus antibody, could be caused by other flaviviruses. That's why we have to do more specific tests and more PCR testing to determine if the Zika is the culprit agent or not.
How does Zika virus spread and how do people become infected? Because it's a scary thought when you think about how one little mosquito can cause such damage to a person.
That's true. Primarily, as we mentioned before, it's mainly by mosquitoes. However, mosquitoes are not the only modes of transmission. This infection could be transmitted through pregnancy. Pregnant lady can pass the infection to the baby during pregnancy or even during delivery. The other mode of transmission is mainly sexual. And I think everybody heard recently about sexual activity that could be related to Zika virus, and seems to be men are the main source of infection. Usually infected men will transmit the infection to his partners. It's very hard. We don't have at this point any idea if the females will be able to transmit the infection, but it seems to be mainly related to semen, to ejaculation. So that's why CDC came with a lot of guidelines regarding sexual protection and regarding risk of transmission for Zika virus. It could be also transmitted through blood transfusion. If you get blood from somebody who's infected from Zika virus, it can definitely cause the Zika virus infection. That's why we need to exercise extra precaution when it comes to screening for blood transfusion, especially in endemic area.
Absolutely.
So what we do not know at this point, that if the infection could be transmitted by deep kisses, we don't know if it comes from the vaginal secretions, and that's why I said mainly it's transmitted from infected man to his partner, could be male or female, but at this point there's no reported cases of transmission from female to her partners.
Where are people infected with Zika, and should those people, we hear a lot of, travel season is here with the summer, where are they infected and should it be restricted?
Okay, so this is a problem now. We reached the pandemic level. We have most of these infections mainly in the South and Middle Americas. We have some definitely local cases of infection in the United States territories, mainly Puerto Rico. But in the United States at this point, we don't have any local activities. Most of the infection that we have in the United States are imported to United States. Okay, we have travelers coming to the United States carrying the infection and transmitting the infection to partners. We don't have local transmission by mosquitoes. However, we're gonna see basically few outbreaks coming recently to the United States, because we have almost 40 states in the United States with Zika virus mosquitoes. So these called the IEDs, and these IEDs definitely capable of carrying the mosquitoes and give it to somebody else. So I think it's just a matter of time, because you need the infected person to come to the United States, been bitten by the Aedes mosquito, and this mosquito will give the infection to other people. Again, as I mentioned, this is just a matter of time, and I believe we're going to see it transmitted locally, and a lot of experts saying that.
How does, you mentioned pregnancy before, and the pregnant mother passing it along to the baby. How does it affect pregnant women, and is there a link between Zika and other issues?
Yeah, the Zika virus now is a reportable disease. The United States, the CDC, trying to collect all the data regarding Zika virus. We're trying to collect all the complications from Zika virus, so we have to do further analysis to be able to determine the real relationship between Zika virus and other complications. We know that definitely microcephaly is one of the problem, but we don't know if Guillain-Barré also is directly related to Zika virus. That's why we need to have more idea. We have to collect all these pieces to be able to figure out the real relationship. But if you look at this picture, and this is basically taken early in the morning from the CDC website, and you can tell that we have 234 pregnant women, either resident or visitors, are found to have Zika virus in the United States. If we talk about Puerto Rico, we have 189 pregnant women, infected with Zika virus. So at that point, we have 6 cases of microcephaly. 3 of them were detected after birth, and 3 pregnancies were ended. So it seems that we're seeing more cases of birth defects at this point in the United States. But the main problem now is the microcephaly. And the microcephaly, it's a problem that affects the baby, and it caused major brain damage. And this is a picture showing to you the difference in the size between normal baby and the microcephaly baby. The brain is small, the skull is small, and this is definitely indicative of birth defect. And at this point, we know that Zika virus can cause that. We have to rule out other problems when it comes to microcephaly, including nutritional problem, genetic problem. We have to also rule out other infectious etiology like rubella, CMV, and toxoplasmosis, because definitely can cause this kind of problem. But we have a lot of questions, pressing questions regarding Zika virus and birth defect. We don't know which one is predisposed to have genetic defect, which one will have the baby with microcephaly or with other congenital problems. At what certain point during pregnancy, pregnant woman will be mainly affected. So a lot of questions that we don't know at this point, hopefully will be subject to further studies and further analysis. But we can tell that this is a serious problems, and we need to prevent our pregnant ladies from having these tragic events. We need to cocoon pregnant female. And I think we have to exercise extra precaution. And we have to come with vaccines, we have to come with medication to prevent from these events from happening in the future.
Does Zika virus, and I may say this wrong, is it Guillain-Barré disease? Syndrome, Guillain-Barré syndrome?
Yeah, there is GBS syndrome,
okay.
Yeah. So there are a lot of studies now, a lot of cases showing that Zika virus could be linked to Guillain-Barré, which is an autoimmune disease that can affect your nervous system, leading to paralysis and weakness. Although this is not pathognomonic to Zika virus, a lot of other viruses and other autoimmune diseases can cause that, but we're trying to see if there's any direct link with Zika virus with the Guillain-Barré, because we know in Brazil we have a lot of cases, and we start seeing more of these cases now also around the world. So it's very nice to study the direct link between Zika virus and other neurological events. It seems that we are in the right track at this point, because studies recently showed that Zika virus attacks directly we call it progenitor cells, which are the neuronal stem cells. The main, we call the cells that can produce other cells, neurological cells. It seems that Zika virus attacks at least 20% of these cells. What's interesting about Zika virus, it can go unrecognized by our immune system. And that's why it causes remarkable side effects. On the top of that, recent studies showed that this molecule called interferon-induced transmembrane protein is a very promising molecule, because if we know the mechanism of action of this molecule, we can produce vaccine and we can create remedies for the Zika virus infection.
Let's talk about how Zika is diagnosed.
Okay, Zika diagnosed by travel history, symptoms, and test. But as I mentioned, symptoms are not pathognomonic of Zika virus. You have to do the test to figure out if the patient has the Zika virus infection or not. We recommend all pregnant ladies, travel into endemic area to be tested. We recommend all the infants with any birth defect to be tested for Zika virus, just in an attempt to study the link between these birth defect and the Zika virus. The CDC guideline regarding testing is by doing urine specimens and blood specimens, especially within the first 7 days. It's also good to do the blood test. It's mainly PCR test, and they have a little bit better accuracy than serology. However, if you have a negative test from PCR, it doesn't mean that you don't have the infection, because you can miss up to 10 to 20%, and negative test does not exclude the possibility of Zika virus. That's why sometimes we do serology testing and we do confirmation testing we call plaque reduction neutralization test, and these tests are very helpful to determine if you've been exposed to Zika virus or not, and also can help you exclude other possibility from other flavivirus infections.
How is Zika treated?
At this point, we don't have any specific treatment for Zika virus. Hopefully, further knowledge will lead to invention of treatment and remedy, as well as vaccination. Again, no vaccination. The treatment will be just symptomatic, rest, fluid, and we call them antipyretic agent like acetaminophen or Tylenol to reduce the fever. But definitely, people need to rest. They have to stay home. They have to be responsible, because during this phase, they are viremic, which means they have the virus in the blood. And if they got bitten by mosquitoes, the mosquito can get infected, and then this mosquito can transmit the infection to other people. So we have to be very careful to protect ourselves and protect our community from having the mosquito epidemic.
So definitely we don't want to get bit by any mosquitoes, especially these. So let's talk about what we can do to minimize our risk of getting Zika and preventing the mosquito bites.
So we need to prevent mosquito bites because mosquito is still the main source of infection at this point. And there are multiple steps cited by the CDC to prevent you from having mosquito bites, including screens. You have to keep the doors closed. You have to have air conditioning at home. Try to avoid outdoor activity without using repellent agents. Try to wear long sleeves and try to use permethrin that treat clothing to prevent these mosquitoes and insects from biting people. If you follow all these steps, definitely will be helpful to minimize the risk of mosquito bites. But on the top of that, we have to be also responsible regarding the other modes of transmission, including sexual activities. And here we have to basically practice safe sex when it comes to Zika virus. We know that the virus stays in the blood up to 7 days, but it stays much longer in semen, at least 62 days. So it may go even longer than that. So that's why men coming from endemic areas and having pregnant ladies or they having childbearing women like looking for pregnancy, they have to be very careful. And the recommendation is, especially for pregnant female, to abstain from having sex or to use condoms for any kind of sexual activities for at least 6 months. Okay. So the other things, if a pregnant lady trying to go to endemic area, it's not recommended to go there. However, if they need to go there, they have to be very careful. They have to exercise extra precautions, prevent themselves from being bitten by mosquitoes. They have to be tested frequently if they have symptoms, or even they don't have symptoms, to make sure that the infection will not be transmitted to the baby. But even any childbearing woman coming from endemic area should be tested for up to 8 weeks, just to make sure there's no infection going on in her body and minimize the risk of transmission of that infection to the baby.
So if they have traveled to that area, the first thing probably they should do when they get home is see their physician and have a blood test done immediately.
Absolutely. If they're contemplating pregnancy, they have to be tested earlier, because we try to push for that pregnancy around 8 weeks to prevent transmission of infection to the baby.
Yeah, I love how your slides say, do your homework before traveling. Education is key when traveling outside.
And this is basically from the CDC website, and they have wonderful slides regarding the Zika virus, and they have nice brochure how to follow the steps needed to prevent mosquito bites, sexual transmitted diseases from Zika virus, and as well as what are the steps needed when you have to travel to endemic area.
We talked about what people can do to minimize their risks of getting the virus. But the slide we're going to talk about right now talks about people who moved to Rio for the 2016 Games. That's been something that's been heavily talked about.
Yes, and this is it has posed a lot of stress recently, because we're gonna, at this point, and I checked this a few weeks ago, we have 2,500 cases of microcephaly in Brazil. We have a lot of cases of Zika infection in Brazil. And we're talking about close to 800,000 international visitors, with 15,000 athletes going to the Rio for the Olympics. I think this is posing a lot of pressure on everybody. We know the complications, we know the consequences of events that could be accompanied by Zika virus. And I think as a healthcare professional, this needs to be addressed carefully. Either they have to cancel it or they have to postpone it to somewhere else where there is no Zika activity. On the top of that, Rio has other problems, including the dengue, Guillain-Barré, including other like mosquito-transmitted diseases. And I think this is definitely will pose more pressure on everybody going to Olympics.
As we move along, I just wonder if modified mosquitoes can help to combat this epidemic virus.
Because of the side effects and complications of the Zika virus, we have to look for any way that can prevent these mosquito bites to happen. And a lot of people now coming with the new ideas about more genetically modified mosquito in a way to prevent transmission of Zika virus. There are 2 companies producing these genetically modified Aedes species. One of them, it affects mainly the male. They change the genetics of the male, and after they have the eggs, then these eggs will die before reaching maturity. The other one It has the bacteria, it's called Wolbachia in it, and this will kill the virus and prevent the Zika virus from being transmitted to other people. We don't know at this point the safety of these mosquitoes, and these companies has asked the CDC and FDA to get a patency to start doing work here in the United States, and I think they're going to start probably in Florida. But we have to study a little bit more to know exactly the efficacy and safety of having mosquito-modified mosquitoes in the United States. On the top of that, I think we have to push for the 1.8 billion battle plan, okay, because it has been opposed in the Congress for a few months. We need to work hard on that. We have to come with vaccine, with medication. We have to be proactive here. We don't want the virus to come here in the United States. We don't have weapons to fight against the virus. So I think we have to push forward and try, hopefully, to get this approved and try to create some vaccines and medication for the virus.
If I were planning, or let's just do this, if I were to get infected now with the virus and then want to become pregnant, say, in 6 months, or have plans for a year, what is my risk, or should I wait a longer period of time to explore that?
This a lot problem, again, as I mentioned earlier, Zika virus has a lot of mystery behind it. But some countries recommended put off getting pregnancy for at least 2 years, like in El Salvador. However, in the United States, we don't have such guideline regarding stopping pregnancy, because all the studies showed here in the United States, the majority of female getting pregnant at critical age. Mm-hmm. And it's very hard to say at 35 you cannot be pregnant for 2 years or 3 years until we figure out, because we know this is very critical age. The CDC did not recommend holding off pregnancy as long as you follow the guidelines of CDC. Supposedly you should be on the safe side. But I have to mention something like recently the study showed that the risk of birth defect are reaching 1 to 15%. Okay, so this is not a small number. And on the top of that, we're talking about a huge epidemic problem. We're talking about huge rates of Zika virus infection. And definitely this is a worldwide threat. And we have to come with something as soon as possible to prevent these tragedies from happening.
Yeah. So if you're already pregnant and you get bitten by a mosquito, what should you do?
If you're bitten by a mosquito, you have to be tested definitely. All pregnant females in endemic area or bitten by a mosquito in endemic area for the right situation. I'm not saying here in the United States, because we still do not have the local activity of the virus, okay, in the United States. But if you go in endemic area, you've been bitten by a mosquito where Zika virus activity is circulating, definitely you need to be tested for that. And if you tested positive, then we have to do serial ultrasonography for the baby, because this is the only accurate way to figure out if the baby has the birth defect. The problem is the majority of these birth defects are not detected till late during pregnancy. We're talking about 15, 16 months or 15, 16 weeks to 20 weeks. So this is very late. Yeah. And I think this is posing a lot of pressure on couples, because nobody would love to live in mystery. They want to know exactly for sure what's going to happen to the baby. And my concern here, will increase the possibility of abortion. And unfortunately, it's very sad, but again, you cannot blame these couples, especially we know these microcephaly babies do not live very long. Yeah. They will die at a certain point very shortly after pregnancy.
If I am bitten and my baby is born and is normal, are we in the clear after it's born normal?
There's nothing in the clear, because the congenital problems are not only microcephaly. We can see other issues like we call clubfoot.
Right.
We call it like microcalcification of the brain. We have eye defects. So if somebody born with no microcephaly, doesn't mean they don't have congenital problems. And this is something, a subject of time. You can see them down the road later on. So unfortunately, no one can say you're in the clear if you're born without any congenital defect. And that's why the United States, we're trying to collect the data regarding pregnancy and regarding the birth defect to know exactly what are the complications of Zika virus on babies.
Let's talk about our pets for just a moment, though. A lot of us have fur babies, as we like to call them at home. Are they at risk for being bitten, or are we at risk for transmitting anything to them? I just wonder.
I don't know if you have the same dog or some.
Mine's a little different.
But okay. At this point, there is no activity in animals, so there is no cases of infection in animals in the United States. They are not risk of becoming sick with Zika virus in the United States. This can change in the future, but at this point, all pets are safe at this point. No documented cases of infected animals or infection coming from animals at this point in the United States.
Certainly, we just need to exercise extreme caution when traveling or being outdoors, making sure that we protect ourselves, our children, our pets, even as much as we possibly can. We have talked about a lot of different things today, a great deal of information. What is the most important thing about Zika that you want our audience to know today?
As I mentioned, this is a hot topic. For sure, we don't know way more than we know about Zika virus. What we know at this point, the tip of the iceberg. Hopefully we collect all the pieces in the next few months, and next year we know a little bit more details about the complications. But for sure, we need to come with treatment, with vaccine to prevent tragedies. This is basically concerning. With 1 to 15% chance of Zika virus birth defect, I think this is a huge number now with the huge activity of Zika virus infection. On the top of that, we have to be responsible. We have to prevent our country from being infected by Zika virus. So coming from endemic area, we should exercise precautions to prevent this from happening locally.
You always say education is key when discussing any of our topics. Dr. Fadi-Alacross, thank you so much for your time today. I know you're a busy, busy person, but we appreciate you spending some time talking about this most prevalent issue in our society today. Thank you so much.
Thank you for having me. Have a good day.
This has been Health Talk, a service of Pikeville Medical Center, proud member of the Mayo Clinic Care Network.